Breastfeeding pain is the #1 reason for weaning, followed very closely by low milk supply. And a lot of the times it can be fixed. You don't have to be in pain. For the past 5 years of working in holistic postpartum care, I've worked with so many mothers who left the hospital in pain, and within one session they're no longer in pain. Sometimes it's just really quick fixes. So let's talk about why it's hurting so that you can figure out what to do next so that your nipples are no longer in pain and breastfeeding can be enjoyable. So why does nipple pain happen? There are a number of reasons: latching, positioning, tongue ties, improper flange sizes, strong suction, infection, hormones. These are just a few to name many reasons as to why you might be in pain. Now, in order to figure out how to fix something, it's imperative to understand why it's happening in the first place. So where do we start? The location of the pain. Where is it hurting? Let's break down the nipple into 3 main places: the surface, the shaft, and the base. If you are noticing pain at the tip of the nipple or the surface, it could be one of 3 main reasons. Number 1, if the tip of the nipple is itchy and white and it burns even when you aren't feeding and you keep noticing yourself pulling at your shirt or your bra, it could be thrush. Thrush is a buildup of fungi or yeast. And why does this happen? Well, after birth, we're often given antibiotics to help prevent infection, and it fights off this harmful bacteria that could make us really sick. But it also kills the good bacteria that helps prevent yeast or fungal overgrowth. So we don't have these warriors who keep this fungus, this fungal buildup away, and they're allowed to multiply. Second common reason is if you notice that the tip of the nipple is pinched. Sometimes this is called a lipstick tip, and this is often due to a shallow latch. Now, there's a lot of reasons why shallow latches happen. Sometimes it's as simple as changing the body position of your baby. Sometimes it's a new feeding position. And other times it takes a little bit more work and we have to do training of the tongue in the mouth. But we'll talk about that in a second. The third most common reason is that you notice the tip of the nipple being white or purple after a feeding, and it's this stabbing, burning, almost like it feels like someone's electrocuting you. This could be something called vasospasms or Raynaud's phenomenon. It's all about the blood vessels. They are constricting and it's causing this intense pain to happen, and you'll see your nipples change color because of this. Now, if you are noticing pain on the shaft, typically it's one main reason why shaft pain happens, which is redness and cracking of this area. This is often because of repeated pressure in the same spot and the baby sometimes using their gums to hold the nipple in place instead of their tongue. And it causes nipples to crack, and when that happens, bacteria comes in, because sometimes we keep these brush shells in our bras to help catch the letdown in between feeds, and then that warmth and that milk next to that cracked nipple can just cause infection, and it starts to hurt. Now you might be wondering, why would we continue to feed in the exact same position over and over again if it hurt? Because people keep telling us that pain in breastfeeding is normal. It's not. It is a sign that something is off, that we need to adjust something. So don't just grit your teeth and bear it. It can cause your nipples to crack open. Now, if you're noticing pain at the base, which is where the shaft of the nipple connects to the areola, it is often because of 2 main reasons. The flange is too small, or pumping suction is too high. So now that you know a little bit more about the type of pain you have and the location of the pain, let's talk about how to treat it. If you have thrush, you'll need a topical antifungal treatment for mommy and baby, even if only one of you guys have symptoms. Within a baby's mouth, you might notice white patches, like inside their lips, on their tongue, even on their lips. And it will continue to be passed back and forth between mommy and baby unless both are treated at the same time. Now, with a shallow or a painful latch, how do we treat that? There's a few different ways. First is immediate. Hi! What are you doing? The rain is here, Nora. I'm so happy for you. Good job. Love ya.
Love ya.
Love ya.
Love you too.
Love you so much. Engorgement often leads to shallow latch. So what is engorgement? It's when your breasts are so full, and when that happens, it can flatten the tip of the nipple. Get this? There we go. So when it's so full, the nipple gets flatter, and that makes it more difficult for the baby to latch on. So simple hand massage, reverse pressure softening. We want to get a little bit of milk out to soften the breast, so that we can compress it so baby can have a comfortable latch and you don't have to be in pain. Now, latching is such a huge topic. I actually made a video specifically about latching, and you can watch that here. But the basics of it is compress your breast, chin touching breast, head, neck, and spine in line with the baby's tummy towards your tummy. This sets them up for a deeper latch. It gets you guys in a more comfortable position for them and for you. You can watch this video, though, if you want a more in-depth approach to exactly how to achieve a wonderful latch. Cold compresses are going to be your friend if you have swelling. I do not suggest using any kind of cold compress prior to a feeding or pumping session, as it can reduce the amount of milk you're getting out. But afterwards, if you are having like swollen breasts, not just full breasts, but you can see that you have some swelling, you can use cold compress. And one of the last quick tips for a good latch is safely unlatching. We don't want to just like pull our nipple out of their mouth, because they will clamp down on it the minute they start to feel it going back. So what do? You take your pinky, you put it in the crook of their mouth, and you wrap it around your nipple, and you slowly pull it out. This is going to protect your nipple. You will thank me later. Now, if you have vasospasms or Raynaud's phenomenon, warmth is your friend. Stay away from cold. Anything that constricts blood flow is going to cause you so much more pain. So caffeine, smoking, cold hydrogel packs, and anything that's cooling, stay away from it, because that will cause you more pain. Warmth is your friend. Most standard flanges are actually not the correct size for the mummy. And if you are pumping on a too small flange size, you're going to have cracking at the base of the nipple because of that repeated friction of pulling the nipple into the shaft. If you think you have too big of a flange size, it means that your nipple is pretty much going all the way and you're not getting much milk out. I have a more in-depth video on pumping that you can watch, but basics is the higher the suction doesn't mean that you're going to be getting more milk out. It just means that it's going to be pooling more firmly. And that leads to nipple damage. Now, one thing we actually didn't talk about in the beginning was dermatitis, which is just dry, itchy, scaly patches of skin. This can often take place, and that's not really on, sometimes it's on the nipple, but sometimes it's just on the breast as well. And this can happen because of our body just being a little bit more sensitive after birth. So sometimes it's just our detergent, and we might need a topical corticosteroid to help with that itching. And our body just kind of gets a little bit more sensitive, and we have reactions to things that it didn't bother us before. So if you are noticing that you have like this dry, patchy, scaly skin, and it's like itching, it could be dermatitis. And sometimes the first step is just switching out the detergent to a more sensitive detergent. One thing I really do want to talk about is mastitis, because we didn't discuss this, because it's not a nipple pain, right? It's a breast pain. But oftentimes it follows nipple pain. When we have nipple pain, when we have nipple damage, it often leads to developing mastitis. With mastitis, it will be a specific localized place on your breast that hurts. There will be redness, there will be swelling, and you kind of feel achy, like your body just won't feel quite right. You might develop a fever. You need to get the milk out. Get the milk out immediately. If this is your third or fourth bout of mastitis, call your doctor right away. But if this is the first time you've ever experienced this, if your symptoms don't go away within 24 hours, call your doctor. You might need to go on a second round of antibiotics to fight off that infection. If this video has been helpful in any way, shape, or form, will you just give it a thumbs up and subscribe, because it's very encouraging to me, and it helps get these videos out to more mummies who might need this help. Hope it helps. Love ya. See ya, pizza.